All right. Good afternoon, everybody. It's 4 o'clock, that time we get together Monday through Thursday, give an update on what's going on in state government, but most importantly, on our efforts to defeat the coronavirus. First, let me say, after another day in quarantine, my family and I are still doing great. We've had more time with the kids, which I want to take as a real positive out of this. And again, we're striving to have a positive attitude, given that really so little is being asked of us. And if it prevents others from being exposed to this virus, we are more than willing to do it. It's about setting the example and answering the call, which we ask other people to do. Also, in good news, my entire family tested negative today. We know that it can take a while for the virus to manifest, and so we'll be tested, I believe, on Friday again, but that was at least good to see. So today, in talking about masks, and right now, boy, I'm glad that I wear one, and I wear it each time that I'm out away from my family in contact with people. But today's mask's pretty special. This is for Ashland Middle School. But I got it with a letter from Penny Compton Grubb. And here's what she says. It says, "Dear Governor Beshear, I have made and donated 1,000 masks for people in my area. In fact, I'm one of the fortunate people that donated a quilt square for the Kentucky Mask Square quilt that is on display in our Capitol. I'm a 6th grade special education teacher at Ashland Middle School in Ashland, Kentucky. This school year has faced many challenges for both teachers and students, but I must applaud my fellow coworkers and students on their ability to adapt to the changes and eagerness to teach and learn. No one's comfortable wearing a mask all day, but it is one of the steps we must do to fight COVID-19. I pray that all Kentuckians will accept the challenge of wearing a mask to keep not only themselves safe, but their loved ones as well. I'd be honored if you'd wear this mask that I made. I pray for you and your family's health and safety. Thank you for all that you are doing for our state. As you always say, we will get through this. We will get through this together." I want to thank Penny for the wonderful example that she sets and her words, which probably mean so much to not just those around her, but around the state. People trying to do it right and take care of one another. Wearing a mask is so critical. Please, everybody, mask up Kentucky. All right, we're going to get back to our regular way that we go about these press conferences, because other than me being remote, this is business as usual. I'm still working full days. Government is still moving just like everybody else. We're just having to adapt a little bit different. So we're going to start with our Fast 4 at 4 for the day. All right, and the first one is transportation improvements, which is about National Energy Awareness Month during October, where we get to put a spotlight on nearly 43,000 Kentuckians who produce, transport, and refine our energy. We recognize our automotive industry, which employs about 83,000 in our state, and of course relies on energy. At the same time, we highlight more than 26,000 Kentucky jobs and businesses that are dedicated to increasing energy efficiency across the Commonwealth. With all these Kentuckians in mind, and for our future, for the planet we're going to leave our children, I'm proud that today we're announcing $11.5 million in funding to support reliable and sustainable transportation in the Commonwealth. These funds are part of the $20.3 million awarded to Kentucky under the Volkswagen Environmental Mitigation Trust. In 2016, when I was Attorney General, we held Volkswagen accountable for deceiving customers on cheating on emissions tests. Volkswagens had created a cheat in their cars to make them look cleaner than they were. Now we're using those funds to build a better Kentucky with safe, dependable transportation to help Kentuckians get to work, to the doctor, to the grocery store. This funding will help reduce pollution to create cleaner air and improve transportation options in 4 regions of the Commonwealth. $8.5 million will go towards the purchase of cleaner emission transit buses in areas of Kentucky challenged with meeting federal air quality standards. Transit agencies receiving funds include TARC in Louisville, Tank in Northern Kentucky, Lextran in Lexington, and the Owensboro Transit System. On top of that, $3 million is being allocated to zero-emission vehicle equipment. Based on input received from the public, 75% of those funds will go towards the purchase of DC fast charging stations along highways. The remaining 25% will go to the level 2 charging stations at Kentucky state parks, municipal government locations, and local community places of interest. Finally, in addition to the awards announced today, the Volkswagen Mitigation Fund will cover reimbursement for some of Kentucky's school districts for up to 50% of the cost of replacing up to 5 school buses. Kentucky has long been a leader on energy, and funding like this allows us to continue to find solutions that help our people while protecting the environment. So pretty exciting, and I can tell you, given that this came about while I was Attorney General, it's pretty amazing to see when you want to make sure you use these types of dollars the right way, what type of good can come out of it. All right, second in our Fast 4 at 4, supporting recovery centers. COVID-19, it's impacted so many parts of our lives, and we know there are a lot of Kentuckians that need our help. One of the groups in need is our Recovery Kentucky Centers, which provide safe, stable housing to Kentuckians recovering from substance use disorders. Recovery Kentucky Centers provide much needed care to some of our most vulnerable and house anywhere from 1,500 to 2,000 Kentuckians across the Commonwealth. To keep residents safe, they have instituted social distancing guidelines, provided PPE, and established new cleaning protocols, all of which are necessary to protect residents and staff from COVID-19. So today we're announcing $2.8 million is available through Community Development Block Grant CARES Act funding for 14 Recovery Kentucky centers across the Commonwealth. Each center will be eligible for approximately $200,000 to offset costs due to COVID-19 to ensure safe, stable housing for Kentuckians in recovery. Those are Kentuckians that are trying to break a very difficult addiction. They are doing their best, and we're proud of them. We want to be supportive because whether this is the first time they've been in recovery or the 10th, we want this to be the successful time. These funds will ensure centers can afford and provide PPE, sanitizing supplies, plexiglass barriers, and other measures to keep residents and staff safe and healthy. We appreciate everything these centers do to protect some of our most vulnerable. Thanks for being a crucial part of Team Kentucky. We could not do this without you. All right, third on our Fast 4, vote. It's an exciting day in that today was the start of early in-person voting, and it looked like we had a lot of people come out. Remember, there are 3 weeks to vote early and before Election Day, and there are even Saturday hours. Pick a time, make a plan of when you're going to go vote. We had a lot of Kentuckians, including myself, that opted to vote via absentee ballot. And I can tell you that you can go online, govoteky.com, and check on the status of your absentee ballot, just like when you first requested it. I can tell you I did that online, that mine was mailed in and has been received, so my vote is going to count. My wife used a drop box and has done the same thing. Her ballot has been received. So to all those hundreds of thousands of Kentuckians that voted by absentee, make sure you log on and check to make sure your vote is going to be counted. But now's the opportunity to vote in person safely by spreading out when we are going to do it. So again, I would encourage you, don't wait until Election Day. Find a time that is convenient for you, that you believe there will be less density at that polling place. Wear your mask. You have to wear your mask and vote safely. And remember, this is the bedrock principle of our democracy. Voting is your duty and is mine. And there are more ways to vote in this election than ever before. So let's show this Commonwealth and this country that we like having options. And let's have a record turnout. And then let's pass all these different options into state law so that we can vote like this and again, have higher engagement and higher turnouts in the years to come. Again, you can look at govoteky.com for voting areas. Get out there and vote. All right, and last is our Mask Up KY. This is people who are setting the example and who we will be sending a Team Kentucky mask to. And I know that's not why they're doing it. They're doing it because they want to encourage their fellow human being to do the right thing, to set that positive tone. It's really hard through negative consequences to get a whole state wearing a mask and engaging in social distancing. But every person who's out there doing it right is noticed by other people. And maybe we can encourage more people to come along and to save lives and to be heroes and sheroes like the people that we are about to show. So we're going to start here. And I love this one because she today voted. She wanted to make her voice heard. You can see after early voting the bracelet that you get, because some places don't have stickers. They have bracelets. I know that's been contentious, but really, I mean, for all things to be contentious. But this is wonderful, setting the right example in two of her and our duties, voting and wearing that mask the right way for Team Kentucky. So thank you so much for that really positive example. Looks like she voted in the Yum Center downtown in Louisville today, one of a number of sites in that area where you can early vote. All right, let's go to the next one. This is Knox County Schools, and I've noticed how hard they're trying, and also how they love to put out on social media the good things that they are doing in their counties to encourage others. And I do love that this mascot is wearing a mask, and I hope the person underneath is wearing a mask underneath the costume. But Covering for Kids, made by Lynn Camp's fashion design class. They've been busy since summer making masks for all the school students. With 500 already made, they continue to cut, layer, fold, and sew to make sure that all kids have a kid-made mask. That's pretty special. Stepping up, doing the right thing. We really appreciate them. Sometimes our kids can set the example that we all ought to follow. Thank you to all of our educators out there and everybody who pitches in. Really special during this time. Our teachers are always our leaders, and during COVID is no exception. And then finally, this is from the Why Now mentoring program through the YMCA. It's offered to help hope and healing to teens and families in crisis. This is them finding activities that they can do while masking and wearing social distancing. We appreciate their example, and also this program finding a way to still be there for these teens and to provide this quality programming that hopefully enriches their lives. And I know it enriches the lives of those who participate and volunteer their time. So masking up is something we need to do all around this Commonwealth. We need to continue to encourage more and more people to do it. As you know, I've recently talked to our mayors and our county judges to send out the word, to work on enforcement, but also to truly encourage people the way that we need to. And we have gotten a great response. In fact, several of the mayors have come together through the Kentucky League of Cities and helped prepare a video PSA so that the people of their communities in Kentucky can know that we're all united in this, and that wearing a mask can help us get back to some type of normal. So take a look at their work.
Cities and want to pass along a simple message.
All of us can work together to help keep Kentucky safe.
Social distance and stay informed about the pandemic.
Be sure to pass along these tips and don't pass on the virus.
Make a commitment today to stop the spread of COVID-19 by doing your part. Thank you and stay safe.
There have been a lot of amazing leaders in this fight against COVID-19. We appreciate those mayors and so many across this Commonwealth. Let's continue to do this right. Let's continue to encourage others out there. Let's continue to save lives. That's what we do when we wear a mask. All right, today's COVID report is 776 new positive cases of COVID-19. Now that is down from Tuesday a week ago, and that's positive. But if you look at this Monday and Tuesday together, it's within about 100 of last Monday and Tuesday. But we're going to watch this through this week because, as you know, we've been on this escalation, and we want to watch to see if we are seeing any stabilization. Obviously, it is early, but it's something that we hope for, and I believe that if we see it, it's because we have more people out there doing the right thing. 111 of those 776 positive cases, though, are kids 18 and under. That is a significant percentage of those cases. To date, we've had 81,691 total cases in the Commonwealth since the beginning. New cases by county: Jefferson 142, Fayette 30, Madison County 30, Pike County 27. That's the most we've seen in Pike in a long time. Warren County and Whitley County 19, Bullitt and Jessamine 18, Harrison 17. Remember, Harrison had the first set of cases. Christian 16, Hardin 15, Boone, Caldwell, Davis 14, Kenton, Knox, and Ohio 13, Henderson and Nelson 12, and Campbell, Clay, and Taylor 11. The rest are in single digits. They are on the website. I wanted to mention a little concern about movement in hospitalizations and ICUs. Thus far, it's not threatening our capacity, but it is going up, and that's to be expected. Because remember, if a certain percentage of people who get COVID-19 pass away, a certain percentage of people who get COVID-19 end up in the hospital, certain percentage end up in the ICU, and a certain percentage on a ventilator, obviously the more cases we have, the more individuals, when you multiply that percentage, we can expect to see. So currently hospitalized, 704 Kentuckians. 2 weeks ago, that was 589. Currently in the ICU, 170. 2 weeks ago, that was 129. Currently on a ventilator, 90. 2 weeks ago, that was 81. So some concern in the rise of those numbers. Total tests were now over 1.7 million, 1,706,551. Our positivity rate has increased a little bit to 4.59%. But the tough part about today's report is we've lost 14 additional Kentuckians. It's a big number, and these days are hard when we have this amount of loss. They include a 90-year-old man from Montgomery County. They include a 91-year-old woman from Laurel County, a 68-year-old woman from Madison County, and a 95-year-old woman from Madison County. 3 individuals from Henderson, a 74-year-old woman and 2 82-year-old men. An 88-year-old man from Fayette. 2 more from Henderson, an 87-year-old woman and a 76-year-old man. I think we have our first death from Jessamine County, an 87-year-old man. We lost a 59-year-old woman from McLean County, a 76-year-old man from Davis County, and a 96-year-old man from Jefferson County. That's a lot of individuals. Each one is more than an age and a county. Each one is a special life, a special Kentuckian that we've lost. So let's make sure we lift up those families. Let's turn on our green lights again tonight. Let's ring our bells at 10 a.m. every morning until we get through this. And let's commit to these families that will do everything it can to make sure that fewer families are lost, fewer individuals are lost along the way. Long-term care facilities, this is going to be the one group update that we provide today. Since the last time we reported, 32 additional residents have tested positive and 46 additional staff, 5 additional deaths attributable to long-term care. All right, we're going to kick it over to the Lieutenant Governor, who is going to give us an update on our school reporting.
Good evening, Team Kentucky. I wanted to touch base with everyone today to let you know how our K-12 public school reporting dashboard is going in the public health arena. First of all, I want to make sure everyone knows that our dashboard exists to make sure that we provide an opportunity for our school districts and our local health departments and our healthcare providers to work together to provide a safe return for in-person classes for every child across Kentucky, since that's our goal. Each community is able to use this information as actionable information that helps keep Kentucky open for business and on a path to a sustained return to in-person classes, which is what we all want. So here's an overview of how this dashboard works. Schools are asked to report the positive cases of COVID-19 every day of the week. And this data is provided to our local health departments. There, the local health departments then provide that collected information to the Kentucky Department of Public Health, where it goes through a verification process to check for accuracy. All of this data can be found for your school, your community, and the entire Commonwealth of Kentucky at kycovid19.ky.gov. What you're looking at right now is a sample of the dashboard that is available for any school across Kentucky. So here's where we are. Here's where we stand currently in Kentucky. The dashboard that you're looking at was made public on September 29th. There are 1,732 schools in this database. And as of today, it shows that we have 798 quarantine students and 137 quarantine staff across Kentucky. 1,529 schools have reported data at least one day in the last 2 weeks. So for the overwhelming number of you who are working diligently to keep your kids safe and to provide the information that your families need, thank you. But that also means that we have over 200 schools in Kentucky that have failed to provide this vital public health information to their communities, even one day over the last 2 weeks. That is unacceptable and it's irresponsible. It jeopardizes the health of your students, your school staff, their families, and your community. We all want our children back in their classrooms where they can learn from their teachers and be with their friends. But by not being accountable to your community, you are actively impeding the ability for this to happen. So again, to review your school data or to find out if your child's school is one of the schools that has not reported, please visit kycovid19.ky.gov. This pandemic has taught every Kentuckian what teachers and moms like me already know, and that's that our public schools and child care centers are the lifeline of our economy. So as we work to build a better Kentucky in the middle of this global health pandemic, our education and child care communities have to be on their game more than ever. Every family needs and deserves transparency and accountability from each school district, college, university, and child care center. As our public health experts learn more about the coronavirus, Dr. Stack, Governor Beshear, and I will continue to communicate with honesty and transparency, and we're asking Team Kentucky to do the same. To my teaching colleagues, I have heard from so many of you about how tough this year has been. You never envisioned having to do all the things that you normally do, which is prepare lesson plans, ensure the safety of your students, differentiate instruction, all in a virtual setting, constant uncertainty, contending with dangers of a once-in-a-century pandemic. So as we face this pandemic and work to build a better Kentucky, I want you to know that I hear you. Governor Beshear hears you. Governor Beshear and I, along with Team Kentucky, stand with you, and we thank you for rising to this challenge. We will get through this, and we will get through this together.
Thank you to our Lieutenant Governor. Having an active educator, at least until December, as a part of this administration and as our Lieutenant Governor is just so critical. Understanding what it's like to be in a classroom and what it takes to run a school building. We really appreciate you. And like you said, we appreciate all of our educators out there working so hard during this pandemic. Next, we're going to hear from Dr. Stack. He's going to give an update on the White House's newest report to us. And then he's going to talk to us about a change that we're going to make beginning next week in the data source for our positivity rate. Now, because we're doing this virtually, it's a lot harder for people to ask questions, and it may take a day. So we're going to postpone putting this into practice until this coming Monday. And that's to give everybody a chance to get their questions answered and to feel comfortable about it. Because whether you're us or the media or people at home, what we all want is good information, that we understand where it's coming from and that we can agree that it's reliable. So we're going to present that today. We'll answer questions about it the rest of the week, and we'll make sure that everybody fully understands it and its reliability before we actually put it into practice. So Steve, over to you.
There we go. Now you got me. Can you hear me now? Thank you. It's my bad. So thank you, Governor, very much. I appreciate it. Sorry for my little technical snafu. So I have a few things to share today, as the Governor mentioned. The first, I forgot to mention yesterday. I had the wonderful opportunity and privilege to visit South Central and Western Kentucky last week. Last Thursday and Friday, I drove to Bowling Green, and I visited the Med Center at Bowling Green, and then went to Warren County, Todd County, Christian County. I saw Mercy Health Lord's Hospital in Paducah. I went to Hopkins County, Muhlenberg County, and Grayson County. I did 2 hospitals and 7 local health departments over 2 days. It's different because of COVID, but it was important to connect with folks and to say thank you to our local health department leaders and workers who are doing such hard work for everybody across the state, and also for our healthcare providers at the hospital. So thank you very much. Thanks for your wonderful hospitality. I'm grateful to have had the chance to do that, and I look forward to seeing others in Kentucky as time and circumstances allow, and I look forward to getting back to a better time when COVID is behind us. The Governor has asked me to talk about the White House report today. I'm going to highlight a few things. I will put this in context. We do this repeatedly. I think it's important for people to hear this repeatedly. The White House gets its data from different data sources. Despite the White House getting different data than the state of Kentucky gets, our conclusions generally align, not always, but generally, and we make very similar recommendations. So the federal government, the White House Coronavirus Task Force, has observed that Kentucky is in the red zone for cases. That's the worst color. And we have 101 or more new cases per 100,000 people last week. To put that in context, on our incidence rate map that we use for the schools and for others, 25 new cases per 100,000 makes it red. So we are solidly above the red category by the federal government's measurement. 63% of all counties in Kentucky, according to the federal government, have moderate or high levels of community transmission. That means they're either yellow, orange, or red on the map. The federal government tells us that by their analysis, last week, we had 31 counties in the red zone. That's increased from 5 the week before. We also had 10 counties in the orange zone and 35 counties in the yellow zone. So that's obviously very concerning. That's 77 counties in the red, orange, or yellow zones, and 41 counties in the top 2 categories, which are the greatest concern. So we have to keep up our efforts and keep up our work to prevent the spread of this disease, to avoid the harms it causes. I'm going to ask if you can please project my slides, James. And actually, wonderful. And now, James, just to confuse you, can you go back one? I'll use that real quick to make a point, the incidence rate map you just took down. Very good, thank you. here's the point I want to make. If you look where the red is a lot more common in the rural communities now. So whereas the red may have earlier been in Fayette County and Jefferson County, where we have two of our larger cities, the red now is in a lot more rural counties. And there are many more red counties than there were in the weeks prior. The disease and who it affects continues to change. I realize that unfortunately folks have kind of made up their minds sometimes about whether they're going to mask or not mask. I have to urge you folks, this is not a disease you want to get. People who get it can often get pretty sick, particularly if you're older and if you have chronic medical problems. So I encourage you strongly, I ask you strongly, please wear a mask. We say to keep others safe, but let me assure you, it's keeping you safe too, because to the extent people aren't wearing masks, yourself included, the disease spreads more and you're really taking a risk and you're exposing others to risk too. So as we see this map change and the consequences of it with increased hospitalizations like the governor has shown or described, I think we're going to see, unfortunately, that more people suffer bad consequences because the disease is more active. Let's please all pull together and do the right thing to help each other out and keep each other safe. So now, James, if we can go to my slides and I can use this. The map we just transitioned from is an incidence rate map, and I want to explain and put in context two different metrics we use so people have a chance to understand why we use these, how they are useful, and why they differ. So the first one I'm going to talk about is test positivity. Test positivity does not tell us how active the disease is. We cannot use this measurement to say there's a lot of disease. Now let me put this in context. When we test people, we want to know, are we testing enough to find all the people with disease so we can give them information. We can recommend they isolate and require they isolate so they don't spread disease, find the people that they have exposed to the disease, and ask them to quarantine so we break the chain of transmission, so we stop the disease. That's why the governor, First Lady, and Will and Lila are in quarantine now, is to break the chain of transmission so they don't spread it to anyone else if they were to have been infected by it. So that's why we use test positivity, is to see, are we testing enough people? So I'll give you some simple math numbers to make this more real. If we test 20 people and one person is positive, that's a 5% positivity rate. If we test 100 people and 5 people are positive, that's a 5% positivity rate. The bigger the numbers, the more we have to test to keep it at 5%. We're hitting about 1,000 people a day. That means we have to test close to 20,000 people a day to keep the positivity rate at 5%. So the good news is, since our rate has been between 4 and 5% for the last few weeks, even though our number of active cases has increased, the state of Kentucky is doing a good job keeping its testing capacity in line with the spread of disease. So all that means is not that disease is active or very common. It just means we're testing enough people to find it so we can try to take the right actions. Beyond that point, we have to rely on Kentuckians to do what needs to be done and to wear your mask, to physically distance from each other, to cover your cough, wash your hands, stay home if sick. Those things are essential. Now, the incidence rate map is the map I had shown just before this slide with the colors for the counties. That tells us how many active cases we have on a daily average over the last 7 days per 100,000 people in the population. This now is a good measure of how active is the disease in your county. So this is the metric you should look to see how active the disease is, whereas the test positivity is a measure of, are we making sure there's enough resources to test people who need to be tested? Now, one, I hope that helps to put this in context. And two, for my younger audience, there is a reference, there is a literature reference here in the title on this slide. So extra credit for the young people if you can work with an adult to find out which well-known book I referenced in that title there that I played with. If we go to the next slide, James. So we're going to change how we calculate this metric. We are now making good progress. This has been a long time in coming, but we are making good progress in getting tests electronically. And we're going to transition to using only electronic lab reports rather, to calculate test positivity. I'm going to walk you through why we believe that's a good idea and how it helps. So first of all, these are all the different types of tests in the major categories: PCR, serology, that's antibody testing, and antigen tests. Those are the rapid point-of-care tests. More than 90% of all the tests we do for COVID-19 in the state of Kentucky are polymerase chain reaction, or PCR tests. Those are the gold standard. Those are the most reliable for finding active disease in currently infected people. So again, more than 9 in 10 of our tests are PCR tests. So we are only going to look at the PCR tests. They're the most accurate, and they're by far and away the largest proportion of all the tests. If we can go to the next slide, James. Next slide, James. Oh, I'm sorry. I'm looking at, I have a bigger version on my computer here. I'm sorry. So of the PCR tests for electronic lab reporting, last week, October 2nd through October 8th, more than 55% of all of the PCR tests came in electronically. This means a laboratory has an automated feed from their information system to the Kentucky Health Information Exchange, which then comes directly into our disease surveillance software. This is a wonderful accomplishment. It was not this high months ago. And we are continuing to onboard more labs as we go forward, so we expect this will increase. And to give you an absolute number, last week, when you look at all the tests that were done, on average, we had more than 8,500 electronic lab reports per day. We've also looked, it fans out across the state. It's a geographically distributed sampling. It is a large sampling, and it is more than adequate as a representation for our test positivity rate calculation. So we feel very good about this, and we also feel confident the percentage of PCR tests reported electronically will continue to increase. If we could go to the next slide. Thanks, James. So this is important. If you look at this, the green line are the laboratory tests from all sources. This means faxes. This means if we had a telephone call, which is not very common. This means electronic. This is a very manually intensive process. A lot of people have to collect this data individually, and what you'll see, it's much more irregular. It swings up and it swings down sometimes as there are delays in the manual entry of data, as there are influxes of data. So when we tell you we found a lab that had 30,000 tests that we weren't aware of, that we know the positives, but we don't know all the negatives, that causes this to swing up and down. The blue line are all the electronic lab reports. And if you see, it's a much more stable and steady line. This data stream is much more consistent, much more reliable. But if you compare the green line to the blue line, if you were to map or average out that green line, it pretty well approximates the blue line. So we've done a more than 5-week study. We found that the two numbers approximate each other very closely over an extended period of time. And we believe that changing to electronic-only data to calculate the positivity rate will have numerous benefits. And some other states have already done this before. I'm glad to be one of them that will soon join them. And if we go to the last slide, James. So there are some benefits. One, it's automated. The electronic data comes into the computer, there are formulas calculated, and the data is produced. So it means that we can free up some of our staff to do other tasks, which are really important to keeping people safe. 2, it's a more stable data stream. I hope I showed that on that previous graph. It's more consistent, more reliable. It's more likely to show us from day to day actual changes rather than having swings that occur due to just the unavoidable challenges of manual data or manual intensive processing. 3, it will filter for the past 7 days automatically. So it will only include the recent tests. Now, I think this is good. When we have a lab that comes on board and starts reporting electronically and dumps in a large number of historical lab reports, those will be auto-filtered, so only their most recent 7 days of lab reports are included. That's very important because this measurement, this positivity rate, is supposed to be a 7-day trailing average of the daily positivity rate. So we don't want data from 2 or 3 months in there. This will automate that process and keep that data stream pure for the purpose it's intended. And the fourth part is just to reassure you, when we take all the PCR tests that we're aware of and we line them all up and down, the median, the one in the middle, is about a 2-day time frame from the time the specimen's collected to the time it's released, which means most people in the state of Kentucky are able to get a 2-day turnaround for a PCR test. So that's a good thing. If I could go on, this done with my slides, and Governor's been very kind. I want to point out 2 more things and then I'll move on. First of all, I get things here and I'm at the office, so this is a danger with this. I want to thank Jackie, because Jackie sent me things to keep my mask from fogging, and I don't have a way to respond to you, so thank you. I asked people to write me letters. I've got letters here. I got letters from Louisville, Stanford, Clayhole, Frankfort, Lexington. People are concerned for themselves because they're active elderly. These are people out in the community doing things and active and vibrant, but they have medical problems or they're over the age that puts them at risk. They're worried about their own safety. They're worried about their families and their friends and their loved ones' safety who will get sick from this. They're worried about their fellow Kentuckians for the same reasons, but they're really concerned. The consistent theme in here is they're frustrated when they go out to stores and other places of business and find other people in the community not taking this seriously and wearing masks. So for your fellow Kentuckians, I'd ask you to please wear masks. I also get cards, and those are very nice too, as an uplifting end to my day. And I'm told that there's a whole pile of these over at the Capitol. And because the governor's quarantining, we haven't been there. We're going to go get them. And the last thing, Governor, I just want you to look over my shoulder. I got to get this right. I improved the wall hangings on my wall up here. It's not as big as I wanted it to, but I'll try to make it the size of that wall before we're done. So that's a picture of Governor Beshear up there. So we'll work on making that better as we go forward. Thank you very much, Governor Beshear, and thank you everyone else for your time.
Thank you to Steve. I think his new catchphrase is, I got letters. We're really lucky to have him. He is great to work with, and we've all lived through some tough times, and I've appreciated his friendship as we've both gone through the stress that all families are dealing with and that we're dealing with here in Frankfort. And I know our leaders across the Commonwealth are dealing with. When you got good people next to you, it certainly makes doing the right thing that much easier. All right, we don't have a lot of questions today. And remember, this change in the positivity rate calculation, which Dr. Stack went through in detail, we're not going to do until Monday. So that's going to give the press and the public plenty of time to ask questions. We will answer them because we want everybody to fully understand it and to support it even. Because again, this isn't attempts to poke holes in anything. It's an attempt to get you fully transparent information to the best of our ability. Remember, there are still hundreds of labs out there that send in data that sometimes make mistakes on their end. There's all of our local health departments who work really hard, but need more people and more funding. And we've done what we can to provide both. So there are just a lot of different ways that the data comes in. We think that this will be an improvement on the positivity rate, but we will, like in everything else, continue to improve how we manage the data, how we audit the data, and give you the very best information that we have. And this is a worldwide health pandemic that to us in Kentucky didn't exist here till about 7 months ago. So I believe that we've worked really hard whether it's on the information that's provided, PPE and where we are, our testing. And that's a tribute to so many Kentuckians out there that helped. All right, so the first question is, how am I, my family, and our security detail doing? We're all doing great. My family and I, again, tested negative today, but it's early. But we've got a positive attitude for the most part. I have a 10 and 11-year-old, so on any given day, we might not have a fully positive attitude. Brittany has taken it like a trooper. She's been amazing in supporting our entire family this entire time. And this is just one more challenge that we will face, but we will face together. That's how we promised to do things when we got married, and that's how we have done it each and every year. The member of my security detail has mild flu-like symptoms. He's going to be okay. We are thinking about him and everybody else out there dealing with COVID right now. All right, next question. In California, fake ballot boxes have been put out in the community. One person who admitted to being involved said there's no law against this. Could it happen in Kentucky? In Kentucky, all drop boxes for ballots have to be approved by the State Board of Elections. And to make sure that someone doesn't try to violate that policy, we're going to be putting up a list of all drop boxes by county on govoteky.com. Most of the county clerks have it listed on their website. It's been published in the newspapers. We want to make sure that no one would try to take advantage of people and try to make sure their ballot didn't get in. Think about that in a democracy, trying to prevent people from voting. That's just wrong. And whether you're a Democrat, Republican, Independent, whatever you are, we want your vote to count. And I hope that we never see an organization that tries to prevent that. We've certainly seen some that try to trick people out of voting. That is wrong, pure and simple. We're better than that. You can't be doing that. Melissa Patrick, Kentucky Health News. After last week's phone call with mayors and judges, have you seen any or heard of any steps that they're taking to step up based on our plea for help? Yes, we saw that in the video today. We are hearing about it in communities across Kentucky. And remember, not every step that our local leaders or our state leaders or individuals out there who want to do the right thing results in some fine or some punishment. It's as easy as if you walk into a place that's not doing something right, say something about it. It's important. Most of the time, if it's brought to that manager's attention in a store or in a place or in a restaurant, or that people aren't doing it right, they're going to step up and make sure that it's done, because we're all out there watching and we all want to protect one another. One of the things that I asked our mayors and county judges to do, which I know they're doing and their staff, and we're doing it too, is making sure that we don't go to a place where these rules aren't being followed and not say something too. So it's on all of us, every single one of us. And while I've focused a lot on those that lead their cities and their counties, you and your actions are probably more important about nicely demanding that those places that these rules apply to follow them, because it might be your life or your family member's life that's impacted. So all we're asking people to do is follow those top 10 rules to defeat the coronavirus. And we know that if you do, that we can stop this escalation, and hopefully we can get to a safer place. They and all other information are on kycovid19.ky.gov. That now has significant information on a wide variety of topics, as much information on this virus as you could ask for. Again, during a pandemic, we want to be transparent, and we always want to be transparent, but give you probably more than you want, but you can look at the parts and pieces that you need to. All right, so I think about 50 minutes in today, we've gotten through today's update. Let's stay safe. Let's answer the call. I can tell you that my family feels good about doing our duty, and I know that you do too. We are so connected right now. When a virus jumps from one of us to another of us, it means that we've got to look out for each other. Our values tell us to do that. our faith tells us it's one of the most important things that we can be doing. So let's live up to those values. Let's live up to our faith. Let's be the type of good Kentuckians that I know we are. We take pride in where we're from. And now we got to step up and protect where we're from and all the people who live around us. And we'll see you at 4 p.m. tomorrow. Thank you all very much.